Midwife services are coming to the Lakeshore. Spectrum Health Zeeland Community Hospital is expanding their services. It's planning to expand even further in the future. Good afternoon, ladies and gentlemen. I'm News 8 digital anchor Luke Lester here from the Wood TV Live Desk. Joining me today, certified nurse midwife Katie Steele, to explain hospital-based midwifery services and why they're important to families here in West Michigan. Katie, good afternoon.
Hi, Luke.
So you're a certified nurse midwife. Let's start a little bit with your background and your role here in all this.
Sure. I come from a background of being a nurse for almost 20 years, 15 of those being in labor and delivery. And I just really have loved that world for a long time, was looking to advance my career and discovered midwifery. And I'm just really excited to bring it to my community. I got that by going back and getting a graduate degree in advanced practice nursing, similar to like a nurse practitioner.
Why transition? What made you want to make this move?
I was just feeling kind of a nudge to continue on in my career, and I loved the idea of continuing in patient care and being able to really pour into women's birthing experiences more than just the day or two that I cared for them in labor and delivery. So this was a really exciting opportunity that was presented to me, and I've just grown in my love for midwifery as the more I get into it.
Can you explain what midwifery is and kind of the services that surround that role as a whole?
Sure. Everyone asks, do midwives only deliver babies? But we can actually do so much more. I definitely hope to focus on maternity care, prenatal care, and caring for women all the way through labor and delivery. But I can do any type of women's health services from puberty all the way through menopause. So regular annual gynecological visits, doing help with fertility testing or testing for sexually transmitted diseases, as well as postpartum care, menopause care, or fertility.
Tell me a little bit about the staff and support system that's going in with this addition to Spectrum Health Zeeland Community Hospital.
Sure. I can work with all sorts of healthcare providers. I joined a group where I'm the first midwife in the practice, along with 5 physicians, and we really collaborate a lot in our care of patients. We work with certified MAs who help provide care with vital signs. And then at the labor and delivery, I collaborate with the nurses and the physicians to make sure that women have the safest and best experience they can in labor and delivery.
Why is it important to have these kind of services, not necessarily just there, but just in all of West Michigan for West Michigan families?
Sure. Midwives have a great reputation of really focusing on physiologic birth and looking at pregnancy, labor, birth as a normal process in a woman's life. So midwives really bring a shared decision-making base to care. I desire to explain things really well to patients, to come alongside patients, and I want them to feel like we made decisions together to individualize care and help them have the best labor, birth, pregnancy experience that they desire.
I want to talk about the demand for something like this. Are we seeing an increase or a rapid increase in demand for these kind of services? What ultimately brought this on?
There is a demand for it. Spectrum Health has been using midwives throughout their system in many different settings for several years, and they're being utilized really well throughout the Grand Rapids community, and Spectrum feels strongly about bringing it to the Lakeshore community. There's not any midwives in the Lakeshore right until I joined that are doing full scope and taking part in births in the hospital setting. So it was a really great opportunity for me to jump on board here in the Lakeshore.
So you've been in healthcare for a while now. You're the first midwife. Tell me about just your personal excitement of being able to take on this role.
Sure. I'm so excited. Having started pursuing this degree without having worked with midwives in the Lakeshore, I really was excited that they were willing to look into and pursue it in this area. I love my community. I've worked at Zeeland Community Hospital for my whole career, and I just felt so blessed that they were willing to bring this service line to the Lakeshore.
Katie, we really appreciate your time to chat with us here. Anything else that you'd like to add?
I just would encourage people to look into what certified nurse midwives can do, what kind of experiences they can bring to labor delivery and women's health care, and reach out to find a midwife in your area.
Ladies and gentlemen, if you tuned in maybe halfway through this stream or just now clicking in, you can click the link attached to this stream. It'll take you over to woodtv.com where you're able to view me and Katie's full conversation. We'll have it there. Again, Katie, thank you for your time. Have a great afternoon.
Thank you.
Ladies and gentlemen, this has been a look at the Wood TV Live Desk. I'm News 8 Digital anchor Luke Lasser. Have a great afternoon, ladies and gentlemen. We'll see you around.